Okay. While we wait, there's one question that Brandy and I keep getting asked, and that is around sales tax, gas tax, and other revenue projections. We know those conversations are happening now, so stay tuned. We'll get information as soon as we have it in the days and weeks to come. Lieutenant Governor, I see that you have now joined us. So welcome to the weekly call with UAC and with the League.
Thank you, Cam. It's great to be back with you.
And before we get started, I have one question that has been burning on my mind and admittedly has nothing to do with COVID-19. Can you bring yourself to watch the ESPN special about the 97-98 Bulls? Because I, for one, cannot. It's still too soon for me. In fact, I'm sporting my 90s era Jazz tie in protest. But I just have to ask, can you bring yourself to watch it?
So it's a great question, a very important question, Cam. And the lack of sports in our lives, we're all pretty desperate. My kids told me that we had to hate watch it together, and so we did watch the first two episodes Sunday night. The good news is there was no jazz in those first two episodes. It's the last ones that I'm most worried about. I've tried to prepare them for the terrible Dick Bavetta calls, the Howard Isley 3. Yes. The Miss Gold and all of those things, but I'm sure
the Ron Harper 3 that shouldn't have counted. Yep.
I'm sure my kids are going to be as devastated as I was back then, and so it's probably unfortunate, but that's where we are.
Well, perfect. Well, thank you for answering my important question. Thanks for the time today. In a normal year, we would all be in sunny St. George for the League mid-year convention. We're not there this year because of COVID-19, but we're grateful to have you on the call. So take it away, and we'll get to the Q&A at the end of the event.
Okay, well, thank you so much, Cam and Brandy, and to your teams, and to everyone who is on this call right now. We're so fortunate to have great leadership at the local level, and just want to share a few things that I think may be of importance that hopefully will give you all some hope, some really positive news. Let me start with kind of where we were. Even during our last call a week ago, you'll remember I shared with you how concerned we were that we had seen testing numbers drop even though capacity was increasing. And we put out a call to encourage people to get tested. We had expanded the testing criteria. Anyone with any one of 6 symptoms could now get tested. The good news is that message finally did get out, and we have seen our testing numbers increase dramatically over the past week. I think we had 4 days over 4,000 tests, and when we had this conversation last time, we were having days right around 1,000 and even less than 1,000. So to see basically a 4-fold increase in people actually get testing is really good news. Today, we got some of the best numbers that we've had at all throughout this. We had over 4,000 tests come back today. Now there is a lag, I will say. So we're really talking about Saturday, the weekend. And then Monday, as those negative tests take a little longer than the positive tests. But the most important thing is we had over 4,000 tests and only 80 of them were positive. That's probably the best ratio we've had between total tests and the number of positive tests. And so that's great news. We've been saying that the numbers have flattened, and now we hope that this means that we're starting to decrease, which under the Utah Leads Together plan and under the President Trump's plan would certainly open us up if we're able to see that sustained decrease starting, would allow us to significantly open the economy even more. Just a reminder that we are one of just 8 states that doesn't have a statewide order, and we've been working very closely with local institutions, which is what's so critical about our approach and always has been, to give us those opportunities to look for hotspots, and that's where this testing is so important. That's the good news, is that we are seeing just rapid and positive improvement. The bad news is that we are seeing some hotspots, and There are hotspots in very vulnerable places. We've talked on this call before about our long-term care facilities, and unfortunately, this disease in particular is just devastating for those types. Nursing homes and long-term care facilities are homeless resource centers. It's something we've been concerned about from the very beginning. We put precautions in place early, but even those precautions, as we've discovered, that asymptomatic cases are spread more easily than originally thought with this virus, and we've just seen, in fact, a large percentage of our deaths have come from those long-term care facilities, as the virus can get in there and rapidly move from host to host. The other concerns we have are with our multicultural communities, specifically the Latino community that has been particularly hard hit. A disproportionate number of positive cases from our Latino community, and a disproportionate number of our hospitalizations have come from our Latino community as well. And that is not unique to Utah. We've seen that just about everywhere. The original numbers out of New York and Michigan and other places. There are several reasons for that. We do know that this virus tends to impact socioeconomic communities. Those that are on the lower end of the socioeconomic ladder tend to be most impacted. Some of that has to do with working essential jobs, jobs that have remained open or they're unable to work from home. Some of that has to do with a lack of information about what's happening. Can also be a lack of the ability to isolate within families if someone does get sick, and the lack of appropriate hygiene and the education around that, with washing hands and those types of things. And so it's something we've been concerned about, but those numbers are troubling. We are working very closely. We'll have more of this at the governor's press conference on Thursday, but I just wanted to let this group know that while we have been producing our materials, they've been translated into 14 different languages. The National Guard has been helping us with that. Just getting them out in different languages doesn't necessarily mean it's getting to the people that need to have it. So we are working very closely. I co-chair, or actually I chair, the governor's Multicultural Commission, and we have brought them in, the executive director, Nubia Pena, to help put together the right group of people to really go out into these communities and help get the information where it needs to go, using community leaders, making sure that again, we have the materials in the right hands, that some of those health disparities can be mitigated, and taking our mobile testing labs out to where they're needed. We've done this down on the reservation in San Juan County with our Navajo friend. But to bring this into other areas in the state, in Salt Lake County, we're working very closely with County Health Department there and others. Just a reminder, this virus doesn't care what the color of your skin is. It doesn't care what country you're from. Doesn't care what your legal status is. It just cares that you're a human being, and our response should be the same. Shouldn't care about any of those other things. It's preventing the spread and saving lives, and so that's going to be a real big focus as we try to mitigate those issues that we're seeing there. Just a couple other things. We just finished a press conference at Merit Medical. It was a really great day. They started production on their swabs, and those swabs are desperately needed, not just here in Utah, but across the country. They're critical for testing, and there's been a worldwide shortage of those swabs. You may have heard over the weekend the mayor of Michigan and others talking about how they were actually slowing down testing because of their lack of swabs. We almost had to do that a couple weeks ago. We were able to find 100,000 swabs. We paid way too much for them, but we couldn't back down on testing. We got them here, and that was a short-term fix. But in the meantime, Fred Lampropoulos and his team said, "Hey, I think we could make those. Let's see what we can figure out." For about 3 weeks, they've been working around the clock to design. And these, you think swabs and you think, hey, it's just a big Q-tip, and it's actually not. It's a really complicated device that they have to they have to use, and they've been able to retool, and they're ramping up production. Soon they'll be at about 10,000 swabs per day, ramping up to 50,000 swabs a day, which the state of Utah has ordered 400,000 already. Several states have contacted them and asked if they could be next in line, including FEMA, who is desperate for more swabs to get where they need to go. So that just speaks to the ingenuity of Utahns and the willingness to really step up. There are probably a million other things we could talk about, but those were the high level ones I wanted to hit. And let's get to the questions so we can try to hopefully answer as many of them as possible.
Terrific. Thank you, Lieutenant Governor. Yesterday, we held a town hall between the League and UAC that included Congressman Ben McAdams, Natalie Gochner, and Phil Dean to talk about the Utah Leads Together 2.0 plan and what that means for local government. Both cities and counties have been asking questions of Brandy's team and my team about what that stabilization phase will look like at City Hall or at the county chambers. So for example, as a city and a county and a town, we are employers, but we also facilitate the economy. We provide services for the quality of life of our residents. So they're really we play dual roles there. And so this question is both in our role as an employer, as well as making sure we can facilitate the economy. And that deals with the access to masks, PPE, sanitizer, and the other types of equipment and supplies that cities, towns, and counties are going to need as we shift into the stabilization phase. So what can you tell us about the availability of those types of supplies and how cities, towns, and counties can access those types of supplies?
Yeah, so this remains, again, one of the most critical and most difficult supply chain issues that we have. We are starting to see supply chains loosen up a little bit, and mostly that's because of manufacturing that is starting to happen right here on our shores. However, because we've done such a good job of mitigating the spread of the virus here in the state of Utah, that has bumped us further back in line to get many of these important items. They're being prioritized through FEMA and others as the federal government has kind of assumed control of that supply chain and putting those out to hotspots in Louisiana and Michigan and New York, New Jersey, other places that are struggling more than the state of Utah. And so we're working very diligently to improve that. Ben Hart with the Governor's Office of Economic Development has taken that lead. They're going to be announcing later this week, I believe, some more local manufacturing that is happening around masks specifically. Masks seem to be probably the most important, I would say. Not just for our frontline workers, but for all of us as we get back to business. And this is going to be really important as we move into the next phase. In order to avoid a spike and having to dial things back again, we're going to have to wear masks more often when we're in public and in areas where we are around other people. And so that's going to be employers, and that's going to be citizens and consumers as they move about through the economy. And so we're doing everything we can to ramp up production. What I would say is we would, to help facilitate that, those requests, we would encourage you, if you're not able to get it through the open market, and more private providers are ramping up daily, but to please put those requests to your local county emergency manager or your health department. They are working very closely with our supply chain and delivery here in the state. We, of course, the prioritization still and for the foreseeable future will be for our doctors and nurses our EMTs, those on the front line dealing with this virus. But as those come in and our supplies are available, we will be working with your local county health departments and your local emergency managers to fulfill those requests wherever we can. I would also say we're going to have to get creative with this. The thing about masks is that we don't need N95 masks for everyone, and the way in fact, that we should preserve the N95 mask for those who are on the front lines. What we're really trying to do with the other masks is to stop the spread. And so it's not so much that if I wear a mask, it protects me from other people. Me wearing a mask protects other people from me. And those droplets then get trapped. And that's why you don't need an N95 mask, because we're not spreading it out. It gets trapped in the fabric. And there are several, including I think the CDC, self-help where we can make our own masks out of cloth. You can take a T-shirt. Someone yesterday, the Dr. Scott Gottlieb, formerly with the FDA, sent out that shows how to fold a regular T-shirt to make a mask. Then you can just wash, and it works out well. And just folding it without even cutting it up or doing anything to it. There are others that show that. We have lots of people out there in our communities that I know are looking for opportunities to help and would be willing to make masks. And so we're going to have to be very creative in the short term to figure out how to get masks on as many people as possible, and we'll share some of those ideas around. But this is we are doing everything possible. Hopefully, you've seen Project Protect. I would encourage you, again, at coronavirus.utah.gov. You can go and learn more about that as well. I also think projectprotect.help is the exact web link. And it's a collaboration between the University of Utah and IHC and the Church of Jesus Christ of Latter-day Saints to make 5 million masks. And and they're making actual medical grade masks as well. They send those out, but some great resources there. And we'll continue to dialogue with all of you to work on fulfilling those requests.
And if I could.
Terrific. Thank you, Brandy. Take it away.
Yes, thank you. And if I could also, in conversations earlier today with the Restaurant Association, they're looking to local leaders and the state to help, as we know their industry has been particularly hard hit, as they look to opening up with additional guidelines of what they need to do in order to make sure it's a safe environment for patrons to visit their businesses. They're looking to us to help fulfill that requirement as well. So just for our local leaders to know that, any efforts along those lines to support those businesses, they certainly appreciate. All right, Lieutenant Governor, so I just have to put a plug in for Sanpete County because this one was submitted from Commissioner Lund there, so I know you can appreciate that. However, this has been asked several times, and that is as we begin moving to the stabilization phase, and of course we've had a chance now to look at the Utah Leads Together 2.0 plan and what that looks like. How fast do you anticipate that process happening? And I have a little bit of insight, having now serving on the commission. But if we could get some clarification over who makes the decisions. There's a regional aspect to it where there's the red phase, orange phase, yellow phase, and then green phase. But who makes those decisions? How quickly do you see that happening?
Yeah, thank you, Brandy, and thank you, Commissioner Lund. You're probably even better situated to answer this question than I am, Brandy, because you really are in the heart of this. So let me just share a little bit about what came out of the special session last week, and probably should have talked more about this. I know you guys are keeping everybody up to date, so I don't need to add to that. But what has happened is working collaboratively with the legislature, this new commission, this Health and Economic Commission that Brandy sits on, is going to be really important. It's made up of 10 members, many of them representing health and the others representing the economy, as well as local government. And they will be making recommendations to the governor by statute. In fact, they will they're required to make a recommendation to the governor tomorrow So it's moving very quickly, and on starting to move into those different phases. And so I think we are all anticipating that, assuming the numbers continue to look good like they are now, that on May 1st we will be moving from red to orange. And now again, that could change, and this is not some sort of announcement or hold me to that. All I'm saying is that I think is the anticipation out there. It's certainly the timeline that we've been working towards, and I know it's been the discussion of the commission. Now, as far as the localized piece of this, those discussions will be absolutely critical. There were other bills that, regarding kind of how we make those decisions. The legislature wanted additional communication from the executive branch, and also from local health, and in conjunction with their county officials. And so the plan does anticipate the ability for differences within local local counties and even local cities, as we find out where those hotspots are. And so we will be having those conversations. Ultimately, what will happen here is a recommendation will go to the governor. The governor has until I believe April 30th to make a to either agree and begin implementation of those recommendations, or if he disagrees, to say in writing why it's not the right time, and why it should not happen. What I will say is we are using the metrics that are included there. We look at those every day. I would also encourage everyone to look at President Trump's plan to reopen the economy as well. It's very similar to ours, and there are definitely some metrics that are included in there that are similar to ours as well. But the things that we're looking at are, of course, testing. We're looking at hospitalization rates. We're looking at that trajectory, the bed space, just all of these critical issues that will let us know that we're not overwhelming our hospital system, and that we are flattening that surge. And that's what's happening right now. We anticipate that will continue to happen, and that by May 1st we will see significant openings. I will say the governor did make an announcement today. You may not have heard that yet, but it is actually part of moving one piece of the economy into orange, and that is the resumption later this week of elective surgeries, and not all elective surgeries. It will be outpatient surgeries. What he's done is said, we are ready to go. And this was a recommendation from the commission and from the task force both today, that he do that. And it's the hospital association is working together to come up with guidelines that must protocols that must be met for those surgeries to resume. This will be very good for our hospitals, for doctors and nurses, and especially for our citizens, many of whom have put off surgeries, while not life-threatening, that are really critical to their health and well-being. And so there's a couple things they have to do in there to make sure that they have that they have sufficient supplies of PPE, that we're not draining those supplies, making sure that the people getting surgery have been tested and are not positive. One of the concerns we've seen this in New York and some other places, that they started testing in one hospital. They started testing all expectant mothers who were coming in to deliver, and found out a surprisingly high number of them had tested positive, even though they may have been asymptomatic. But that then could spread to others in recovery, or to our doctors and nurses. And so that's one of the provisions that will be in there, is that the people need to be tested before they go into surgery, and that will be happening. So that's good news. That's the first kind of shoe to drop as far as opening. But we really do believe that May 1st is when we'll see a significant move from orange to red, or from red to orange, excuse me.
Yeah, red to orange. So as a follow-up question then, Lieutenant Governor, related to Brandy's question, can you just give us the status on restaurants, and then even just that decision-making process locally, so that you could have one region that is still red, whereas another region of the state could be orange. And then the third piece of that is that testing is critical. We've had a lot of questions, including one from Gary Resk, who's the Woods Cross City Administrator, around testing. Can you also just give us an update on the Silicon Slopes effort, how that dovetails in on overall testing and other outreach on testing around the state off the Wasatch Front?
Sure.
Yes,
Thanks,
I hit
Cam.
you with 3 at once.
So yeah. We no, that's good. We are again expecting that, and again, it looks like the state, because we're all in the same situation, is moving pretty much in lockstep, and we'll be having those conversations with localities as the recommendations come in from the commission. And so look for those recommendations. I think that will be the starting point for those discussions. But we look, I can't state this emphatically enough. We have to get our businesses open. We just do. We can't stay in this mode much longer, or there won't be any businesses to open. And it's just the devastation. It's hard to imagine. I don't think any of us have really wrapped our heads around what this means economically for people, and let's also remember that there are health impacts to that, and to people losing their jobs, and to the isolationism. And so we are focused on making that happen, but doing so smartly. And that's where it doesn't have to be one or the other. And if we can open these restaurants and keep people 6 feet apart, and make sure that we're practicing really appropriate hygiene, and we're wearing masks, those who are working in the restaurant, we can do this without spreading the disease. And so that's going to be really critical, and we're hoping for May 1st. On the testing side, this is also really, really important, and it's one of the reasons we've had to do what we were doing. I'll just remind people that the purpose of social distancing and asking people to stay at home wasn't just to flatten the curve. In fact, it wouldn't have been necessary to flatten the curve if we had enough testing in the first place. This was to buy us time to ramp up testing and tracing efforts. And we are leading the nation. We're top 5 again in testing. Part of that has to do with Test Utah. And so to Cam's question and point, now, we have incredible testing facilities through ARUP at the University of Utah, and through IHC, which is the largest healthcare provider in the state. We also have access to national labs that some of our other hospitals use. The problem with the national labs is the turnaround time can take up to 7 days, and that's not real helpful for people. The good news is locally, most of our tests are coming back in 24 to 48 hours between ARUP and IHC, and the state lab, which has also increased capacity over the past couple of weeks. Test Utah was a private sector effort working with Silicon Slopes to help expand that testing capacity. And so they worked with the lab at Timpanogos Hospital, and they've been ramping up that lab to process things quicker and more tests. They have stood up testing facilities that aren't tied directly to a healthcare provider in the state. So they're kind of an independent operation, I guess is the best way to describe it. They now have, I want to say, 7 sites open. The first 2, one in Provo, one in Orem, one in South Ogden. I think there's one in Wasatch County. And then they opened up in Vernal and Roosevelt and St. George over this past weekend. And so those 7 sites, you can access those at testutah.com. There is a survey that you fill out that asks about your symptoms and if you've been in contact with anyone else. That data is very helpful to the state health department to, again, give us an understanding of where the disease is and where symptoms are right now. And then when you get to the end of that, it will say, yeah, you should get tested, or you shouldn't get tested. And here are the Test Utah sites. You can click on those sites and try to find a site near you. And then they have time slots throughout the day. You can click on one of those time slots. It will give you a QR code. You just go to one of those locations, drive through. It's very quick. It's very easy. You show them the QR code. They scan it. You drive through. They test you right in your car. They process your lab, and then they email you the results in again, 24 to 48 hours. Could take up to 72 hours. And they will again, they will notify you. It doesn't cost anything. And so it's a great system. Now, if you get to the end of that, you could also find out that there are no spots available that day, that they've already been filled. There's a link there you can click that will take you to ARUP or IHC, and you can reach out to your healthcare provider and get tested at one of their sites. Now, I wish that everybody was on the same platform. That would make life a lot easier, and we could drive everyone. That's the panacea. That's where I would like to get. We are not there yet. These are, again, disparate groups. They have their own systems. We're trying to work closely together. And so we do have options, though. And Test Utah is one of those options. But if you aren't able to get tested through there, don't panic. Go to IHC or ARUP, and they should be able to get you tested there. Now, we did struggle with people getting turned away. Sometimes it's hard to get the new testing protocols out to every single receptionist and doctor and nurse and healthcare system and phone bank, all of those. It took a few days. Most of them are working well now. However, if someone gets turned away who does have a symptom, you can email us coronavirus@utah.gov, and we will personally reach out to the provider to let them know that they need to start testing people who have those symptoms. So we're trying to work through that. But again, we went from about 1,000 to over 4,000 tests. We even had one day where we were over 5,000 tests, and that's just great news for Utah.
Perfect. Thank you, Brandy.
Lieutenant Governor, this next question comes from Commissioner Evelyn Warnick in Millard County, as well as Aaron Wells, the Highland City Assistant City Manager, but we've heard it from many others as well. We touched on it a little bit last week, and this has to do with how counties and cities should be preparing for summer activities, rodeos, 4th of July parades, festivities. And if I could just also mention, this morning I received a phone call. I know that there is a group that's being organized under the Economic Response Task Force, specifically dealing with live events, summer sports activities, Shakespeare Festival, all these type of things. And it's more along the lines of looking for what measures could be put in place in order to make these things happen. So I know that there's a group that's talking. They've got several different companies that are involved in that, including those who provide the AV and some of those, the concessions and the different parts in order to be able to make those events take place. But do you have any additional information? I know this is an ongoing concern of our members and something that's continually being talked about in the concerns with mass gatherings, but any additional information?
So what I would say is don't cancel things yet. If you don't, if you don't have to. I mean, obviously, if it's in the next couple of weeks, then that's going to be very difficult. We do know that mass gatherings are the hardest to bring back because of the super spreader nature of those types of events. However, everything, things are changing so rapidly, and we would love nothing more than not to have to cancel those. So the formation of this group is really important and something that we've wanted to get the kind of best practices and best input. What could that look like? Let's plan ahead. We've been saying for a long time that we're going to prepare for the worst and hope for the best. Now I want to flip that, and I want to also now start preparing for the best case scenario, hoping that it will happen, and changing the way we look at things. So how could we figure that piece out and allow it to happen? How can we break it up so we don't have people right on top of each other? And again, I've said this before, but I'm betting on us. I'm betting on the innovators here in our country and in our state. We're looking at some of the trials that are going on, the drug trials that are happening. There's an Ebola drug that is in trial right now. The University of Chicago has been doing trials. It looks very promising. Again, not a cure, but something that could prevent the most serious symptoms and hospitalizations and potential death. And if we can start to avoid those things, then it changes the calculus as we get closer. We also, there is evidence that there is some seasonality to this disease, not as much as we would hope, but some. And so that changes things as well. If we start to see a downturn in the infection rates just based on the seasonality of this, of being outside, of not being in quite close quarters or close proximity, that could really help us change things. So we're having those conversations. I will say we're having conversations about what spring sports could look like if we push them back, and if the rates continue to fall down, with the state superintendent and others. If there are any ways to do any of these things, we want to figure out how to do it. And so stay tuned as we come back with this group and give some recommendations and see what the next few weeks hold. But again, what I would say is, if I look back 2 weeks at the way the landscape has changed just in the last 2 weeks, looking at how things might look in June or July, it could be very different, and we're hoping it will be very different in a positive way. That being said, as I talk about the seasonality of this, I also want to put out just a little bit of caution and concern. One of the big concerns that we all have, and experts at the national level, is that a spike this fall, that we could see a recurrence, maybe even worse if we're not careful. And so it's going to be really easy to kind of let our guard down, especially if the numbers start to fall off. We've seen this with pandemics before. Of course, we saw it with the 1918 Spanish flu. In Utah, the second spike in the fall was as bad or worse than the first one. And we want to avoid that as well. But let's just keep having this dialogue, and hopefully we'll have better answers as we get closer.
Thank you.
Perfect. Thank you, Lieutenant Governor. And I want to just add a couple other details about the group that Brandy referenced. They actually are having their first meeting right now. I was on the call for a brief period of time before I jumped over here. We do have league staff that's involved. I know UAC is involved. The committee is being chaired by an executive from the Larry H. Miller group of companies. But the very first words out of her mouth, out of Amanda Cummington's mouth, was, we want to implement best practices for rodeos and for smaller city and county events that then we can learn from she used a different name, but it's still the Delta Center to me, but that we can use at larger venues as we all work toward that stabilization phase around mass gatherings. So that group includes people from the Cultural Alliance and includes people from the public sector. If you in your city or county want to be involved, contact Brandy or me. Again, our staffs are involved right now, and they're being very aggressive at trying to have recommendations in place, because they know everyone is planning for the summer. We're all hoping for the best, and Lieutenant Governor, we're planning for the best. And let's see what happens over the next few weeks. So that's the additional information there. There have been a couple of questions in the chat box on this topic, Lieutenant Governor, that I just wanted to reference. People have brought up questions around pools, pavilions, playground equipment, and the like. The governor's directive, so we're all clear, is in place through May 1st, and specifically called out playground equipment and recommended that children should not play on playground equipment during the stay safe, stay home directive time. At this point, no decision has been made about playground equipment, pools, or other similar type equipment beyond May 1st. Is that correct?
That is correct, Cam. That's correct, yep.
Okay, perfect. So that hopefully gives some clarity in this larger group that's looking. We will certainly bring up some of these other facilities and make sure that we're having conversations about best practices around public facilities like recreation centers, pools, and the like, especially as we pivot to the summer months. So the next question that we have for you comes because we are in budget season. Counties aren't, but cities like the state of Utah are in budget season. and everyone's trying to get a sense of the fiscal impact of COVID-19. What can you tell us about the state process around revenue projections and the timing around revenue projections? So, you know, we did have a town hall last week with Julia Tennert. She'll be joining us again for next Monday's town hall with an update. But what can you tell us about the state process that then local governments rely on around sales tax, gas tax, and other revenue projections?
Yeah, and thanks, Cam. And just another reminder: how many weeks have we been talking about getting guidance from the Treasury Department on? Yeah, exactly. It's so frustrating because our hands are kind of tied until we get that guidance. What I will tell you is on our call, is today Tuesday? What is today? Yeah, today's Tuesday. So yesterday on our call with the vice president, we brought this up. Other states brought this up as a huge concern. We were told every Friday we're told we'll have the guidance, and then Friday passes and we don't get it. He told us he would get right on that, and that they would have something to us by the end of the day yesterday. We still haven't seen it, and so you haven't seen it either. You're shaking your head, and so it really is holding us back right now. I did have a conversation with Senator Romney as well about the ability to use funds to backfill for losses, not just for the COVID response. It's something that they're certainly discussing and hoping to give us some guidance on. We were suggestive that they should, give us the money and let us determine the best way to use it. That's always much more effective than the federal government tying our hands or telling us how to use it, especially for states like Utah, where we are more fiscally responsible than others. We should not be punished because we do a better job of balancing our budgets than other states. And so what I would say is stay tuned. The Tax Commission is working very closely with the Governor's Office of Management and Budget. We're trying to figure out the parameters of where we are and the way things are being impacted right now. It's a moving target. It's a yeoman's effort to try to figure out those projections. What I can tell you is, as soon as we know, we will absolutely share those with everyone. We are preparing for the worst. We know that those numbers are just going to be devastating for all of our budgets. And for those of us, I was the mayor and then a county commissioner heading into the Great Recession. We remember what that was like, and this could be even more significant than what we experienced then. And so what I can tell you is, as soon as we have, and again, Juliet is an expert. She knows this stuff as well as anybody. She used to be with the Governor's Office of Management and Budget. The process for us is so the Governor's Office of Management and Budget works very closely with the legislative analyst to come up with consensus numbers that they can use, and there is a process for that. And they are going through that process now, and we look forward to sharing the difficult news once it comes to us.
Well, and Brandy and I and our teams are making phone calls on a regular basis to check in on the process as they work through those revenue projections. So as soon as they have them, we'll be sharing them broadly. And as I mentioned, on next Monday's Economic Impact Town Hall that the League and UAC will host, we'll have Juliet back to give us an update. So, Lieutenant Governor, I know we're right up against the time. Brandy, the final question belongs to you.
Yeah, and this is just kind of a follow-up. So specific to like gas tax revenue. So Cameron's right. We're not in the process of budgets right now, but I received a phone call today from a county who already had gone out to bid for road projects. We're already headed down that path, had a contractor in place, and now are very uncertain about gas tax receipts. Is there anything that we can be doing, or how do we access projections? Maybe it's too early on, but is there any guidance, or maybe it's just bringing it to the forefront of the conversation about projects that were already anticipated and underway based on anticipated revenues that now we know, at least at this point, it doesn't look like there's anything in place to help with lost revenue, at least not at this point. But any projections or suggestions of where we may go to be able to get some guidance on where to move in those projects that were already anticipated?
Yeah, I wish I had a better answer, Brandy. and trust me, we're facing the same thing at the state level. So what I would say is, I'm sorry, but be patient. I'm again, to be brutally honest, it's going to be bad. And I would definitely hit pause on those types of projects. The good news is it's going to get cheaper to do those types of projects. But the bad news is that we're going to have less revenue to do them in the first place. If you've watched what's happening with oil, and yesterday we went into negative territory for the first time, and for those that don't follow this very closely and may have missed it because the coronavirus was taking up so much of our attention early on, but back in the first and second week in March, there were some announcements out of Russia and OPEC that they were kind of going to go to war with the U.S. producers, and they were going to overproduce and create a glut in the market and drive the price down, which was bad news. And then all of this hit, and we stopped driving as a country and really as a world. Every country has seen a significant slowdown in transportation and the purchase of gasoline, which has led to this now overproduction and glut. And there's nowhere to even store the stuff, which is why they're paying people to take it off their hands. And it's driving down prices. We hope to see that come up, but that has significant impacts. I just ask personally, the last time my wife filled up her car was over a month ago, and that was usually a weekly occurrence. Just taking kids to school and piano lessons and all of those things. And so, that's tax that isn't being paid. And the gas tax is probably going to get hit as hard or harder than anything else, including sales tax. And so I do. That's one area where we do have to assume the worst, and we're trying to get projections out of the state tax commission. They're a little overwhelmed. It is tax season, even though it was delayed, but they're not for corporate taxes, and so they're busy processing those types of things, and so we're working with their analysts to get that done, and hope to have something out soon.
Thank you, Lieutenant Governor.
Perfect. Well, thank you, Lieutenant Governor. For the remaining questions on the chat box, we will follow up with those of you who have asked them. We'll follow up with you individually. And again, you can send questions to UAC and the League, and we will get those questions answered for you. Lieutenant Governor, any final words of optimism here as we tackle the week ahead?
Yeah, and I don't want to end on a down note, but we should end on an up note. And that is, again, I just want to reemphasize that the numbers today are probably the best numbers we've ever had. And that means we are getting on the other side of this. And it's something we've all worked so hard to do. Now what we have to do is put all of our energy into helping rebuild this economy. And we know it's going to take time, and it's going to take innovation, but we can do it. We were the best prepared state for a disaster to hit. We had the lowest unemployment in the country. We had the largest private sector job growth in the country. We had everything that we have. Huge rainy day fund, the largest in our state's history, almost $1 billion. Now we know that this is going to dwarf all of that, but what it does mean is that the fundamentals are stronger here than anywhere else, and we can and will come out of this stronger, and we'll do it together. So I am more hopeful than I've been in a long time. I still don't sleep, but that's just because we have so much going on and so much to do. But we can't do it without our local government. And I'm so grateful. You are the boots on the ground. I've said this my whole life. I get asked if it's hard to be the lieutenant governor. And for 6.5 years, I've been saying, yes, it is hard to be lieutenant governor. And let me tell you what was much harder. Being on a city council, being a mayor, being a county commissioner, much harder because you're closer to the people. And I would go to the grocery store, or I would go to the post office, and I would be there for an hour, and my wife would she would leave me, because that people expect you to have all of the answers, and you do it so well. So thank you for what you're doing. Let's keep these conversations going. We're so grateful for Cam and Brandy and their leadership. It's just the most collaborative team I've seen in my entire time of public service now, dating back to 2004 when I was on the city council. So thank you for your leadership and your willingness to work together. This is awesome, and we'll be back together next week.
Terrific. Thank you, Brandy. Thank you, Lieutenant Governor. Thank you for everyone for joining the call, and we'll see you on one of our upcoming town halls.